welcome to Village in Motion. It is Tuesday, May the 8th. I'm Clint Lambert. I'm the host today, and I'm very pleased to have in the studio with me this morning Dr. Dar, who is our medical director, and Crystal Estep, who is our clinic manager, medical clinic manager. And we're very glad to have them both with us, and we're going to be talking about things going on in the clinic this morning. Welcome, guys.
Thank you.
Good morning.
Glad to have you both with us.
Thank you for having us.
What's happening in the clinic these days? You guys seem to be busy all the time, and this is allergy season. What's happening?
Well, you answered that question. This is allergic season, so a lot of people are having allergic problems.
Okay.
And this is one of the favorite place also. You know, people comes here crying and left happily.
Yes.
And they enjoy time afterward. Fortunately, this is a big medical center, and we are offering all type of services. So people are finding it comfortable to come in here instead of going outside, which is very hard to see a physician, making appointment and all those things. But they come freely. We have appointment schedule which is very comfortable. They call us and we give them appointment immediately within 1 or 2 days. And in addition to that, a lot of patients comes in walking.
Mm-hmm.
So most of our residents love to stay in the green village.
Mm-hmm.
So they feel it easily accessible. So even minor problems, they like to see a medical advice instead of treating on their own, which is better. So that's why we're busy.
Are there things that you would rather people not come to the clinic for, or do you just want anybody to come any point in time, anytime they've got a concern? Are there any kind of guidelines in regards to that?
We will not ask them not to come.
Okay.
If they have any problem, they are always welcome to call us.
Okay.
And we can on telephone help them out if they need a medical assistance immediately or no, or it can be delayed. So we will not say that don't come or don't call. We will say if you don't want to come and you are concerned, call us. Yes, it's better to prevent something than having a disease itself.
So give you a call if you have a concern?
Yes.
Okay,
yes.
Very good. And that's 604-4644, right?
Yeah.
All
Correct.
right. I've got it memorized. I've used it so much. Very good. Well, Crystal, you've been busy with all the stuff going on, right?
Correct.
Yeah.
I'm always busy.
You're always busy, aren't you?
Yes, you have to stay busy. Job security.
From your standpoint, are you medically stabilized? I mean, not from yourself, but for the clinic. I mean, do we have enough providers for everybody?
Well, Dr. Pham did resign. They are in the process of looking for another provider.
Okay.
We just interviewed 2 nurse practitioners last week, I believe it was, so that we could get another nurse practitioner over in continuum of care. And then we just interviewed a CMA that starts May 21st to take Abby's place. She won't be doing podiatry. Dina has accepted the position in podiatry and she loves it. So we will have another CMA May 21st, and then we'll be fully staffed.
So CMA means certified
medical assistant,
right?
Sorry,
okay.
yes.
In regard, I just want to make sure
Yes.
everybody understands the terminology. We throw these terms around and these acronyms around. People are like, what is one of those?
Exactly.
Okay.
Yep.
And with the CMA has anywhere from what, 2 weeks to 6 months of education, or they have more?
Well, they have the 6-month training, I guess you could say. Within that 6 months, we hope that they learn the routine, the physician they're going to be with. They're expected to do the front desk as well for triage, so they'll have a chance at the front desk to triage. So fully about 6 months of training for them to be on their own. And now that we're fully staffed, we'll be able to take that 6 months with her.
Okay, very good. And speaking of the front desk, we have Krishna as permanent on the front desk, right?
Correct.
And is there somebody now with her, or is she the only one on the desk?
Shatavia is up there right now with the CMAs, the certified medical assistants. Every 3 months they rotate, so they can all have a chance at the front desk. And we want a certified medical assistant at the front desk at all times for triaging in case anything happens in the waiting room. They can identify it. Somebody walks in with a wound that's bleeding, they can take them into a room and identify it as well. Whereas Krishna, she doesn't have that certification to do that. And it's worked out very well because they've learned that the position next to Krisna is a certified medical assistant.
Okay.
So if they come in with prescription refills or any other questions, they go directly to her,
Okay,
which is a
good.
plus.
Good, very good. That sounds great. With all the allergies that are going on, what's the treatment? What are you doing for us? I mean, we're sneezing, we're coughing, our eyes are burning, our noses are running. What are you doing for us?
Well, seasonal allergies, first of all, what is the seasonal allergy? Seasonal allergy is a hypersensitive immune response to any allergen or antigen which is present in the environment.
Okay.
Most commonly, the seasonal allergy starts from February and it goes end of the summer.
Mm-hmm.
This is the peak season,
Right.
middle of the May. That we are having the highest level of allergies, and seasonal allergies varies from months to months. In the beginning, February starts with pollen, trees, grass, and in the end of summer or beginning of the falls, we see lots of ragweed.
Mm-hmm.
Ragweed
Right.
is the most common allergen
Right.
in United States.
Oh, okay.
Yeah, and as these allergies are seasonal, they slows down. With that, the allergic diseases are also slowing down. So practically what I'm trying to say that most of the time the treatment is symptomatic or there is no treatment. If you can tolerate these allergies, you can live with it and it will go away. The other thing is that you can ask for the doctor to help, and we can give you some anti-allergies medications,
Okay.
nasal sprays, which will help to relieve the symptoms.
Okay.
But the best way to avoid allergies is to keep yourself away from the allergens. So if you are allergic to ragweeds, keep yourself away.
Stay away from where?
If you are allergic to pollen,
Right.
close your windows, put a mask, whatever you feel comfortable, and the allergies are not going to bother you.
Okay, good. So maybe as we get new windows throughout the campus, the allergies people complaining of allergies will decrease
Yes.
in regards to, which we've done a study and done how many people were going to the clinic for allergy symptoms prior to the windows going in, and how many people will go after all the windows are in. So should be something
Interesting.
in regards to that. With the new staff coming in, you're getting a new physician, right?
We will be.
You will be. Do we have somebody in the wings, or are you just
We're in the
recruiting?
process.
You're in the process, okay.
Yeah.
What has happened now that we're down one? Well, we have 4 physicians now.
Yes.
What's happening for residents and for the physicians? We're overloading those 4, or?
We don't overload anybody. I think we are trying to manage it, and we are managing it very well. The moment we realize that we are overloaded, then the process will be very fast to hire one more physician.
Yeah.
So we are fine at this moment.
Okay.
Yeah.
So everybody's getting taken care of in a timely manner?
Yes. Yes.
All right, very good. Another thing I know that residents have on our minds is the fact of all the renovations that are going to take place, the redesign of Town Center. And I've been told it does not affect the clinic as such, as far as any changes with physical changes. But what happens, I mean, there's going to be a lot of work going around, especially starting on the first floor. What impacts are going to have on you guys?
Well, we will see what will happen, but probably it will definitely affect, as we were discussing before they start. You know, one of the problem will be that we frequently calls ambulances and the stretchers comes in, how we will deal with that in the construction area. So there will definitely be more redirections and a problem with accessing the medical center, but all these things are logistic, and I think the planners are considering all these problems ahead, and they will manage it.
Okay. Crystal, I know that you have been participating somewhat with the Town Center design, and you were up on Town Center yesterday showing people the renderings, and you're going to be down in Hunter's Crossing, in Woodland Skies today, right? We're doing the same thing.
Yes.
Has the design committee, to your knowledge, looked at or anybody discussed about having people leave on a stretcher out the side door into the parking lot or anything along those lines?
There's been talk that's gone back and forth about the back door and the paramedics being able to bring them out that way, especially once the cells moves to town center. Going past that on a stretcher just isn't ideal. I mean, it's really not ideal now anyways for
Right.
somebody's dignity. So it's been tossed around. There's no plan set in place. It's just been discussion.
Okay.
We'll continue to discuss it and see where we go from there.
Okay. I think if we could do something along those lines of changing the route that's presently happening, there'd be a lot of happier residents in regards to both those that are not going out as well as those that are going out.
I agree.
Probably incompatible with the state laws.
Yes, yes, yeah. But one of the issues is the fact of getting an ambulance in and out of that parking lot and what can happen with that parking lot. The discussion has been the fact of grading that cutting the parking lot grade down so that it would be easier for an ambulance to get in and out, restricting the use of the parking lot in regards to it. Okay, very good. Chris, one of the other things I know you've been actively involved in is the health portal. What's happening with that?
Well, the health portal, since it has been out, there's been a lot of confusion on it.
Okay.
Today at 2 o'clock, I will be in Village Square, the theater, to present the health portal. I do have a slideshow put together of the basics, and I'll have handouts as well. There are 3 phases to the health portal. Right now, it's just the basics. The next phase will come I'll teach at that time as well, but there will be the ability to see your outside medical records that have been scanned in.
Okay.
The ability to actually make an appointment instead of giving appointment dates and times, to actually go in and see what slots are open and make an appointment. So that's the second phase. The third phase, I'm not quite sure what's going to happen the third phase yet. Let's just get through the first phase and see what happens.
So first phase is the fact of being able to get into the portal, making sure the demographics are all up to date, right?
Correct.
At what point will we be able to, do you think we will be able to look at our lab results and those kinds of things?
Well, you should be able to look at your lab results now.
Okay.
If people are having trouble, I'd like to know about it so I can send it on and have it be troubleshooted. Because I know there are a lot of glitches in it still. For instance, when I use a test patient and go in, I can't see the last office visit.
Right.
And I feel that's pretty important. That's why we have the patient portal, so that you don't have to come down to the medical center and get it printed out. So there are a lot of changes, a lot of glitches, but if there are glitches, I'd like to know about it so we can get it fixed as soon as possible.
So bottom line is communicate with you guys, keep you informed,
Correct.
and make a call if we have any concerns, right?
Yes.
Correct.
All right, very good. Thank you, Dr. Dar.
Thank you.
Crystal, for being
Thank
here
you.
this morning. We look forward to seeing you in the clinic and staying busy.
Thank you.
All right?
Thank you.
Thank you very much.